Very pleased to invite you to this webinar, and thank you very much for your time. My name is Nick Chrysalis, and Peter Keogh's in one of the other screens. Basically, we've got an hour, and I don't want to just sit here and give you lots of information. I want to make this a little interactive, so please feel free to ask questions along the way. Peter will also jump in if he finds something that he wants to discuss. Right, I'm sure you can all see my screen. So let's get started. Hip and knee pain. Well, firstly, I might talk about certain therapies. I don't take any, I've got no disclosures. I don't take any money for talking about any therapies. We are here for one reason, because we feel that no one should suffer from pain. Firstly, is pain a problem? I think we all know that pain is absolutely a problem. This is some documents from about 10 years ago. Effectively, there are 3.2 million of us in Australia that have some form of chronic pain. That's 1 in 5 of us. And the big number, the big issue is that 80% of those people with pain are not getting the treatment that they need. If you get sent to a pain clinic, you'll probably end up waiting more than 6 months to see somebody, and probably up to a year. And pain can cause depression, anxiety, stop you enjoying life, and of course affect your ability to work as well. So it's a big problem. We know that it's a big problem. That's why we do what we do. We have a big clinic. It's growing. It's staffed by a group of professionals, all appropriately trained and qualified. This is all we do. We manage pain. We have a vision, we have a purpose. Our aim is to treat pain as best we can. We use mainly interventional, multidisciplinary approaches, which means we try and steer clear of opioids. We help people to use non-opioid strategies to manage their pain. There are many ways to manage pain, as you know. Sometimes medications can play a bit of a role. Sometimes just healthy living, good diet, sleeping well, looking after yourself can play a role in reducing your levels of inflammation, which can help pain. Sometimes we use nerve blocks. We can lightly heat nerves, pulsed radiofrequency, even burn nerves, radiofrequency ablation, which can help reduce pain. And of course, we can sometimes use surgical interventions as well, using pacemakers and other things for severe, difficult to manage pain. Just a few seconds on how we do this, and I'm sure that some of you might have seen this before, but it's important. We kind of step up the treatment. So we start off with simple approaches, and then we step up to more complex approaches should the pain not respond to treatment. So we're very good at using nerve blocks to diagnose and help treat the pain. Sometimes a PRP injection can be helpful, which is platelet-rich plasma. So there are many other things that we can do for simple pain. We sometimes use nerve stimulation for the more severe neuropathic pain. That's nerve pain, which we'll come on to try and settle and stabilize the pain. But the important part is the base of what we do, and that's to help people get fitter and stronger physically and mentally, because pain wears you out, as you know. And that's a vital aspect, because you don't get better until that's been addressed. We'll help people to understand what's going on, because it's very important, and give you some motivation and a spring in your step to get there. But one of the first steps is to improve your lifestyle, get off or down opioid medications, which can sometimes hinder things, and focus on physical activity, which we'll come to in a couple of seconds as well. So it's a unique approach. Each pain is different, and more importantly, each person that we see is different. Where are we? Well, we're based in Richmond, and we're also based in Martin Street, which is behind Warringal Private Hospital. We have a couple of other locations that will be coming online soon, but these are the 2 places that we consult out of. One of the things I mentioned was that sometimes you can wait up to a year to see somebody in a pain clinic, but our clinic, we pride ourselves on the fact that we aim to see somebody within a month of getting the referral. So sometimes it's much shorter than that, and sometimes a little longer than that, but ultimately 30 days or less is our gold standard. So we don't like keep